I'm Kate from GetPharmacyAdvice.com. Today we are going to go over the safety concerns of the long-term use of proton pump inhibitors, or PPIs. Examples of PPIs are Nexium, Prevacid, Prilosec, Protonix, Dexilan, Azafex, Zegarid, and I may be missing one or two. But if you are concerned that you're taking a PPI and you don't know, you can always ask me. Give me the name of your medication, I'll let you know. But in any case, we are concerned now that these medications have been out for a long time and they are widely used among the population. In fact, more than 50 million prescriptions of proton pump inhibitors are given to patients every year. That's hospitalized patients and then your general patient that isn't in the hospital. So now that we have tons of clinical experience with them, and now that they've been out long enough, we see that they are actually associated with a couple safety concerns or risks. And you'll actually see the trend of physicians decreasing the use of PPIs such that they'll use them for more short-term cases versus using them for long-term cases. And the risks that are associated with them are, one, the increase in fractures. Now, this happens to be a concern in those that are usually 50 years or older, and those that are at risk for osteoporosis. So this is where they're more associated with. Now, we don't know that, it seems that the PPIs cause a decrease in absorption of calcium. Now, this isn't a proven effect, but it is associated, so we just want to use some caution. And in fact, in one study in postmenopausal women, there was about a 25% increase in overall fractures, and then about a 47% increase of fractures of the vertebrae or in the spine. That's quite high, I would say. So in these patients, those that are 50 years and older, or those that are at risk of osteoporosis, you'd want to stress that they definitely take their calcium with vitamin D supplements so that they can kind of counteract these effects or possible effects. The other reason we'd want to be cautious about using long-term PPIs is because they can actually cause infection. Now we're talking infection of the respiratory and the stomach area. For respiratory, we consider pneumonia as the infection, so community-acquired pneumonia or hospital-acquired pneumonia. And then for the stomach, we'd see diarrhea caused by what's called C. diff. Now, the reason that these infections can occur is because the PPIs will decrease the acid in the stomach, and because there's decreased acid in the stomach, bacteria can grow, and then there can be an overgrowth of bacteria which will lead to infection. Now, this actually doesn't take very much time. It can actually occur in hospitalized patients within 3 days or after 3 days or more of therapy, and in your general patient that's not hospitalized, it can actually occur even within a week of therapy. So after a week of therapy, you can see an infection occur. And this is concerning because we don't want to get pneumonia, we don't want infection, and yeah, pretty much that. But in any case, it is concerning. So for instance, it would only take 226 patients to be treated with a PPI when you would see one case of pneumonia, community-acquired pneumonia. So for every 226 patients that are being treated with a PPI, you would get one case of community-acquired pneumonia. Now, this doesn't sound like a lot, or it sounds like a high number to be treated in order to get that one case of pneumonia. But when you think about how many prescriptions are being prescribed, so we already discussed that, 50 million prescriptions, it really isn't a big number, 226. That's actually pretty small. So just want to watch out for this. In another video, I'm going to go over the appropriate uses of PPI, long-term PPIs. We're going to go over who should be using it short-term and who should be using it long-term. And let's see, also the FDA, they're actually so concerned about this increase in fractures or possible increase in fractures and the increase in infections caused by long-term use of PPI that they are now requiring the makers of these proton pump inhibitors to change the labeling such that they have to tell about the risk of fractures, increased risk of fractures now. I'm not sure about the actual incidence of infection if they're making them change the labeling in that, but definitely with the fractures, it's associated with it. That's what they're telling them to tell people in their labeling. So I think that's about it. Actually, one more thing. The FDA has now disproved some concerns that were associated with long-term use of PPIs, and it was thought that long-term use of PPIs was associated or caused colon or gastric cancer. And this has actually been disproved, so there's no concern with that. And also it was thought that that omeprazole could lead to cardiovascular events such as heart attack or stroke or heart failure. And this is also not true, so that's good news. But in any case, like I said, just so you know, there are long-term effects that are now coming out, and we need to use caution. And that would be the increase in risk, the increase of fractures, or the risk of fractures, and then the increase in infections. So I hope that wasn't too confusing. If you have any questions or you're confused, please get to me at www.getpharmacyadvice.com. Thank you!